Good afternoon, everyone. I represent Professor Jin to welcome you all here today and have this little discussion. My name is TIANZE, and I'm an ophthalmology resident, and I am Professor Jin's PhD student. Today, I'm going to take you on a journey from understanding how the human eye works to exploring one of the most common vision problems worldwide, and finally, to see how artificial intelligence is revolutionizing the way we manage this condition. So, have you ever wondered how your eyes can instantly focus on a tiny letter on a page, then look up and see a mountain in the distance, all in a split second? The answer lies in one of the most sophisticated optical systems in the nature, the human eye. The eye is often compared to a camera, but it's far more sophisticated. Let's look at its key structures. The eyeball is like a three-layer cake. The outermost layer is the tough white sclera, the white of the eye, which turns into the clear cornea at the front, where light first enters. Behind the cornea is the iris, the colored part of your eye. It works like a camera aperture, adjusting the size of the pupil to control how much light enters. Behind the iris sits the lens, adjusting the size of pupil to control how much light enters. Behind the iris sits the lens, which fine-tunes the focus by changing its shape. The innermost layer is the retina, which sends light, and we will talk about that in a moment. Between sclera and retina, it's called the choroid. The choroid is packed with blood vessels. It's like a nutrient delivery system for the outer retina. And one more to mention, axial length is simply the physical straight line distance from the very front surface of your eye, the cornea, all the way to the back, where the retina sits. As you can see, it's the red line. Okay. So at the back of the eye is a retina, a thin layer of tissue and contains millions of light-sensing cells called photoreceptors. There are two types, cones, which give us sharp, detailed central vision and color vision, and rods, which help us see in dim light and detect movement. The most sensitive part of the retina is the macula, a small area packed with cones. Think of it as the high-resolution zone of your eye. Like having more megapixels in a digital camera, the photoreceptors convert light into electrical signals, which travel through the optic nerve to the brain, which they are interpreted as images. So, how does the light actually travel through the eye? Light enters through the cornea, which provides about 2/3 of the eye's focusing power. It then passes through the pupil and the lens, which provides the remaining 1/3 of focusing power and adjusts for near and distant objects. The light finally reaches the retina, where it's converted into electrical signals and sent to the brain. It's an incredibly efficient system, but when something goes wrong with this optical pathway, we experience refractive errors, which are the most common cause of vision problems worldwide. Now, let's talk about myopia, or as most people call it, nearsightedness. Myopia is a refractive error which distant objects appear blurry. What does this happen? In a normal eye, light focuses exactly on the retina. But in a myopic eye, the eyeball is too long from front to back, or the cornea or lens is too curved. As a result, light focuses in front of the retina instead of it. Myopia isn't the only refractive error. Let me briefly mention two others. Hyperopia, or farsightedness, is the opposite of myopia. Nearby objects look blurry because the eyeball is too short, or light focuses behind the retina. Astigmatism happens when the cornea or lens has an irregular shape, causing light to focus on the multiple points instead of one, making both near and far objects look blurry or distorted. Many people have a combination of these conditions, but today we'll focus on myopia because it's the most common and the fastest growing refractive error worldwide. Here's a starting fact. Myopia has become a global epidemic. According to the World Health Organization, by 2050, nearly 5 billion people, about half of the world's population, will be myopic. Of this, nearly 1 billion will have high myopia, a severe form that significantly increases the risk of blindness. In some East Asian countries, the prevalence of myopia among children and adolescents is estimated to be as high as 84%. This isn't just a vision problem. It's a major public health challenge. When myopia progresses, it becomes high myopia, which is defined as axial length of 26 millimeters or more. High myopia is associated with serious complications, including retinal detachment, retinal atrophy, macular degeneration, glaucoma, and cataracts, conditions that can lead to irreversible vision loss. So why is myopia becoming so common? Research points to two main factors. First, lifestyle changes. Children are spending more time on near-work activities like reading, using smartphones and computers, and less time outdoors. Studies show that spending more time outside during childhood actually protects against developing myopia. Second, genetics play a role. If both parents are myopic, their children have a higher risk. The good news is that we understand the risk factors and we have ways to intervene. But here's the challenge. Myopia is progressive. Once it develops, it cannot be cured, only managed. That's why early detection and early intervention are so critical. So, what exactly do we mean by AI in ophthalmology? Artificial intelligence, particularly machine learning and deep learning, uses algorithms that can learn from large amounts of data to make predictions or decisions. In ophthalmology, AI analyzes medical images like fundus photographs and OCT scans, as well as clinical data like age, refraction, and actual lens. Think of it as having a super smart assistant that can look at thousands of eye images and clinical records, identify patterns that a human might miss, and make accurate predictions about this progression. One of the most exciting applications is screening. Traditionally, myopia screening requires eye care professionals' specialized equipment and time, but AI can analyze fundus photographs, simple images of the back of the eye to detect myopia automatically. For example, researchers have developed deep learning model that can identify myopia from optic disc images with over 95% accuracy. These AI systems are scalable and cost-effective, making them ideal for screening large populations, especially in underserved areas. For patients with high myopia, the stakes are even higher. High myopia can lead to pathological myopia, a condition where the retina and other eye structures become damaged, potentially causing blindness. AI is providing valuable here too. Deep learning algorithms can analyze fundus images to detect, classify, and grade pathological myopia and its complications with high accuracy. This allows for earlier referral to specialists and timely treatment, potentially preventing blindness. So now I'd like to share a little bit about research we are doing in our institute. We collected ultra-wide field fundus images from more than 5,000 patients with different degrees of myopia. These images capture over 200 degrees of the retina, much wider than a standard fundus photo. Using artificial intelligence, we automatically measure two important things. The first, what we call fundus tessellated density. That's the patchy, leopard-like pattern you see when the thin pigment layer underneath the retina becomes stretched and thin, exposing the larger blood vessels beneath. The second is retinal blood vessels themselves. We measure their density, their average width, and how complex their branching network is, something called fractal dimension. Then we asked, how do these measurements change as the eyeball grows longer, that is, as actual length increases? As the eyeball stretches longer, two things happen. The tessellated density increases, meaning the choroid becomes thinner and more vessels are exposed. And at the same time, the retinal vessels become less dense, narrower, and their branching patterns get simpler. Interestingly, these changes happen at different stages. In the early phase, when the actual length is still below 26 millimeters, the tessellated density around the optic disc and macula is the most sensitive marker. It can detect problems before they become severe. But when the eye becomes extremely long, over 30 millimeters, The vascular parameters are much better at picking up the damage. They reflect microcirculatory failure, which is hallmark of advanced disease. When we combine both types of measurements, our prediction accuracy reaches over 90%. For the most severe case, this is exciting because it means we can now use AI to not only tell if someone has myopia, but also to determine which stage they are in, how fast they might progress, and which treatment strategy might work best for them. That's the essence of precision medicine. Thank you for your attention. I hope this has given you a glimpse into the fascinating world of ophthalmology and the exciting potential of AI in eye care. I'm happy to answer any questions you may have.
Thank you so much.
Good job. Very good talk. So we can go to the question part maybe after my short presentation. Okay.
Yes.
So,
Thank you so much for your presentation.
okay, so I will give my short presentation. So doctors help me to
Okay,
go
sure.
to. Yeah. So next I will talk about the causes, detection, prevention, and treatment about myopia. So let's start with the big question. So what causes myopia? Genes or environment? So what do you think about?
I guess the correct answer would be a combination of both genetics and your environment.
Especially for the young kids, just under 6 years old. We found that Professor Jin in 2017, he found that about 100% of children with very high myopia, the genes can cause myopia 100%. So we think genes play a very important role in myopia, especially in high myopia. But genes are not the dentistry, you know that. So environment also play another roles in high myopia, just like in sufficient outdoor activities and near work and sleep depressions, just like that. A lot of homework, just like parents have to do that. So environment also play a huge role too. But and so from age 6 to 14 is very crucial window to detect the myopia. So here is something every parents and students should know. So don't wait until you can see clearly. From 6 to 12 months, you need to go to the first comprehensive eye examination. Suggest that from 6 to 5 years, vision screening for eyes is also important. And before one first grade, about 5 to 6 years old is very crucial age and full comprehensive examination to establish this life. So this has happened in China, especially in Beijing. A lot of students come here and from schools, and after that, from 6 years old, we suggest every year they need eye examination. Very important. So don't wait for complaints. Just come to a hospital as early as possible. And all right, so what can we do before myopia even started? So 3 small things and very small and simple habits that can make huge difference for us. First is 3-20 rules. It's every 20 minutes looking at something 20 feet away for 20 seconds. So it's very, I think it's very useful for students here. And the second is hold your mobile phones or books at least 13 centimeters away. It's very important. And third, good lighting. Work in well-lit areas. Your eyes will thank you. So I think proper lighting, just like here, is very good. Environment. And the biggest is just get out to play, and especially in sunlight, because when you're in sunlight and your eyes can release some very helpful chemicals, especially avoid the myopia, especially high myopia. So just go outside. Except for school age, at least 2 hours, and preschool needs 3 hours. we do not know. Maybe we luck this time in China, but I don't know in America. Do you just go outside? It's much more time.
I mean, in recent times, young children in America, it depends. Most of the time, they will stay home because of the iPad. They will play video games and stay home. But some kids, a good bit, still go outside to play sports and like play with their friends.
So, are you often go?
I'm a hypocrite. I stay inside in dark lighting and I read or I study. I need to fix that.
You like computer?
Yes.
Okay. So next, so what if myopia has already started? What we can do next if it started? So the goal is not cure it. It's not to cure it, just slow it down right now. So we have 4 main tools here. Specialized eyeglasses, atropine you have already used. Okay, lenses, eye contact lenses, red light therapy.
Yes.
Here. Also in China we use that right now. So eyeglasses, you have to wear that.
Yes.
Only 2 of us. so also we now have some specialized eyeglasses. You can see in the middle of the pictures, there's some tiny macro lenses around the middle. So can create something called a peripheral defocus.
Yes.
Can make your eyes relax.
The defocus lens, they told us about those.
Yes. And also on the left side, you can see the eye contact lines here, like nice wave thick.
Yes.
Correct the cornea shape, so we can see clearly in the daily life.
Yes.
In the daylight. So eyeglasses is most used often here. And the second, you know that already, the low concentration atropine. We use 0.01% to 0.05%. No, maybe and also in Hong Kong and in Singapore and Japan, we use it often. So is that often in America? Use
Yes.
for how many years? Atropine? Yeah.
We only
Yes,
found out about
1
it.
year ago.
Yeah.
Oh,
Yes.
1 year ago.
you use that 1
Yeah.
year ago. About 60 to 7% of the patients can just reduce progression. So it can work.
Yes.
It can work. You can use it with eyeglasses together. So have you heard of the repeated low-level white light therapy?
No.
And right now, this therapy is popular in China, in Asia, in East Asia right now. And we can see the machine left side, and the red light can come out from the right side. And we can see the right picture here. The students, they use this machine. They can do it by themselves. And put the eye here. You can see the machine. They can work, and they will come out the red light in very certain millimeters, about 650. It's red light, and the red. They think some scientists think red light can also avoid progression of myopia. But you have to do that daily, maybe twice a day, and 3 minutes for one time, and 5 days in a week. And some students and parents can do that for about 2 years. And the research about this red light, they found that after 2 years, they found it much stable for many children. So also they can do this treatment at their home. Just buy this machine and go home. They do it themselves, but they must do after doctor's suggestion.
Yes.
Do them by themselves because it's blind.
Yeah.
Okay.
This is not very common in the United States.
Yeah, that is very common in general, especially for children, teenagers. teenagers.
Yeah, when we started to do the awareness, we saw that in our research. When we did the research, me and Camping for his website, we saw that. But when we go to doctor, they did not offer.
No, they did not offer.
US doctors.
No.
They did not offer that.
Why?
The only offer was the 3 options: contact lens, the one that you wear at night, and then the atrophy. They did not
didn't
offer that.
this.
So you don't have this machine.
I don't think
So
so.
you can buy it or just
Yeah.
No,
rent it.
I don't think anybody buys that machine. So when we go back, we have an interview with a professor in USA, and we ask that question. We'll let you know.
Yeah, okay, it's great.
Yeah, we'll let you know.
And yeah, it's just a good discussion.
Yeah.
So right now you offer this device
In some,
to patients.
in some hospitals,
Mm.
and some doctors think it's working. So we will stay for maybe more time, more long time, more than 2 years later. But actually, it's sometimes it works.
So do you have enough research that shows that this is like protective, or it's still in the early stages?
It's not early in the stage. It's already used in commercial.
Oh, wow.
Yeah. Yeah, it's already in commercial, and a lot of children and teenagers have that. So, and also a lot of research about the effective or safety about this. A lot of, and we will see about this in the future. So we know that surgery. Surgery is actually most of the time it's not for kids.
Yes.
For adults, right? Especially for adults with stable version for about 2 years. So you need to more time for the surgery in the future. And the refractive surgery, just like LASIK and SNEL and SL implant surgery, just as I say about this, it's just one very tiny glasses in your eye. You can see clearly without wear the
Yes.
glasses, especially for high myopia. But you must have very stable vision.
Stable eyes, yes.
Yeah, stable eyes. And also another surgery is that to do is about the complication, just as Dr. Xu have mentioned, high myopia and pathological myopia may cause a lot of complications, retinal detachment, macular hole, and the version is just go down like that. But all of these options, they only fix focus.
Yes.
They don't fix eye shape. That's the main point. So in the future, we'll think maybe some other method we
Yes.
want to know, and we want in the future can fix the eye shape,
Yes.
especially the
Extra
extra
lens.
lens. Extra
Yes.
lens.
Short lens.
Yeah, it's a key role in high myopia, especially for progression.
Yes.
And Professor James here, and also we will have the cure treatment about the progression axial lens
Yes.
research right now. Maybe it's the first in our institute in the whole world.
Very impressive.
Yes, it's really amazing in the
That's what I
future,
read.
very near future. Yeah, because myopia is combined genes and environment. The environment we can control right now, but
Yes.
genes cannot. So this is a very big point in the
Yes.
future. So just wait for our research in the future. So, okay. So surgery is about managing and not reversing the problem. Maybe in the future we can do that. Right now, just slowing progressive is not a cure. Just like what you wear glasses, you use
Not a cure.
atrophy eye drops, myopia just stay. So myopia stays a worldwide crisis.
Yes.
That maybe in the future we can find
A cure.
good way to cure it. question and answer part.
So both of you had amazing presentations.
Thank you.
So I can honestly answered a lot of questions, so I'll only ask a couple. So how should parents choose the right treatment for their child regarding myopia or other eye issues?
Maybe I think it depends on the children's eye. Uh, depend on children's eyes. If they have high myopia, maybe they like to take them to hospital as early as possible.
Yes.
So that's the first wear eyeglasses may be the most places
Yes.
in China. I think also in nationwide.
Yes.
And second, atropine just as drug jobs, eye jobs, it also can combine. And also the bright light, you can try about that. So parents can choose a lot of choose right now to just control it, manage it. So if you have complications, you just have to.
Yes. It's not, there isn't one better treatment. It's just there should be treatment.
Yeah.
Exactly.
Yeah.
So my next question would be, earlier in the presentation, you say for children, it's 3 hours outdoors. Yes, 2 hours. Would the same thing go for adults? Should they also spend 2-3 hours, or is it more time outdoors?
Well, that's a good question. So I think it's also very needed outdoors, especially for adults, because we do a lot of work, near work. We need mobile phone. So that another thing is that it's much stable for the adults about the eye shapes. That not including pathological myopia. Pathological myopia is progressing.
Yes.
Of this. So for most of the adults, I think it's good. But for maybe more outdoors, it's good for every human.
Yes, not just for eyes, but just for health.
Yes.
So then, let's see. So, why is a lot of people, when they hear about myopia, they'll say, oh, it's just glasses. Why is myopia a big deal? Why is it more than just needing glasses? Like, what would you say?
Yeah, because when myopia progress, it becomes high myopia.
Yes.
Which can lead to a lot of complications.
Yes.
So myopia maybe is a little word, but when it becomes high myopia, it's a big issue. So
yes,
we should prevent myopia from going to high myopia in an early age. Yes.
Because it can eventually, if left untreated, it can sometimes lead to blindness. Yes. Yes.
Right now, it's the leading cause of blindness in the world.
Yes.
Physiological myopia.
Okay, so then my last question. Throughout this whole presentation, what is one key thing parents, children, anyone, what is the key thing they should remember? Like the main thing, the main takeaway.
So you can answer first.
As early as possible. Yeah.
Detection.
Yes.
Detection and AI detection